And now, it's BoomerLife, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is BoomerLife on Aug15th2016.
This is BoomerLife on Aug15th2016. I'm Joanne Sutton, and the next hour will be spent with our friends from the Alzheimer's Society of British Columbia, talking about what it's like to live with Alzheimer's or another dementia in small town BC. CEO Maria Howard is in the studio with us today, and Maria has an extensive background in the healthcare industry with both provincial and national board governance experience. So Maria, thanks for being here with us.
Oh, it's great to be here, as always.
You've been with the Society for how long now?
Just about 2.5 years. It's gone by very quickly.
It has. So last month when you were here and we talked on the show we tackled a really emotional topic. Wasn't the easiest of conversations, but I'm so glad we had it. It was about end of life. The focus was people living with dementia and their families, how their families can start to talk about how they envision their end of life, how they deal with the emotional ramifications of it, also how they deal with the legal ramifications as well. End of life is not a comfortable conversation for a lot of people to have, and I truly appreciated the contributions we had from all of our guests and the opportunity just to simply start that conversation. We spoke with Dave Obey, the editor-in-chief of the Victoria Times Colonist, and he was a caregiver for not one but for both of his parents as they traveled down that dementia journey. Dave spoke eloquently about the emotional complications they faced when dealing with end of life, both in having the conversation and when the time finally came. We also heard from Dr. Romaine Gallagher, an expert in palliative care, and she gave us a lot of great background on what people need to think about when they plan for the later stages of disease. And finally, we spoke with Emily Clough, a lawyer with Alexander Holborn. And Emily had a lot of insight into the legal processes that people need to be aware of when they're discussing end of life and how they can go about dealing with that side of things as the disease progresses. So now for this month, for August, we'll be focusing on the experiences of living with dementia in a rural community, somewhere outside of the Lower Mainland. Rural communities face very different challenges than urban centers like Vancouver, and that means that the dementia journey can look quite a bit different. So first, let me remind listeners that there's a lot of information about the Alzheimer's Society of BC as well as a wealth of resources, all available on the website. Just visit us online, alzheimerbc.org. So Maria, over to you now. Can you start us off by introducing the topic of living with dementia in a rural community?
Thanks, Joanne. As we've talked about on the show and in many of our programs, having your life impacted by dementia, whether you're the individual who has been diagnosed with Alzheimer's or a type of dementia, or your family or friends or the caregivers, is significant. It's a life-changing experience. As we talked a lot in the show last week, Alzheimer's is a chronic progressive disease that unfortunately is terminal. So to have that diagnosis is significant. Then to live in a rural community where maybe access to healthcare systems, to a number of other supports may be limited because of distance and population, adds in another layer. And it's really important to think about, certainly from the Alzheimer's Society of BC's perspective, how we can continue to help people who are impacted by dementia, who are living in our vast little corners of our province. We have a big province, and people need help no matter where they live, whether it's Vancouver or whether it's a small community like maybe Ashcroft.
So it's a mandate of yours to try to get the information, products, services, programs that you have in an urban centre out to all four corners of the province.
Absolutely. The Alzheimer's Society of BC is a provincial organization, so we are set up to serve the whole entire province. And First Link, which is our program to reach out to families and to healthcare professionals who are on the dementia journey, is a provincial program. And so we are committed through the programs, the services we offer, the information, the education, to make sure that is available. So we have a number of different ways we do that, whether it's through tele-workshops, whether it's through our website, whether it's through local community centers or volunteers. Our services are available throughout the province. And in fact, we have 15 different resource centers situated throughout BC to ensure that all people in our province are getting the help that they need.
So given the aging population in many BC communities, it's a really interesting time to talk about this because a lot of people living with dementia in those communities are actually served by a very small number of healthcare providers forced to cover a very wide region. So what are some of the things that the Alzheimer's Society of BC would like our listeners to keep in mind, or any important phone numbers they should keep on hand?
I think there's a number of things to keep in mind. I think the one most important thing is that regardless where you live, but more importantly in a rural community, that you still need to, we really encourage people to reach out and ask for help and get information, and that it is available. We do have a First Link Dementia hotline, which works around the province, which is 1-800-936-6033.
It's toll free.
And anybody can phone that line to ask questions, ask about information where they can access it, just to sometimes have a chat about a really maybe scary or complicated question. I think it's really important for families too, if they are working with healthcare professionals who may be serving large populations. So in a community there may be one doctor for several people, is again to have the support to know how to ask the right questions, access the right support services so that it helps them get the help they need as soon as possible.
So we're going to start today's show off by speaking with a caregiver, Heather Inglis, who is actually a caregiver for her mother and lives in Ashcroft in the interior. And we're hoping that Heather's going to be able to share a little bit of her experiences as someone caring for a family member with the disease and coming from the perspective of being in a rural community.
You know, I think Heather will bring a great experience. Heather, like many people who live in rural communities, are used to thinking of different ways to access support and education and information. And so I think it's helping people, and Heather will share this, about how you think about the help you need and how you can reach out, again, whether that's through technology or different community groups that you're living close to.
Actually, we're all looking forward to hearing what Heather has to say. And we're also fortunate to have Juanita Little join the show. Juanita is a registered nurse who works with home health in Ashcroft.
Juanita will bring the other side of the story as the healthcare provider who is working with a number of different people who are living either on their own, with or without supports, who are also working with care homes and residential care facilities, who are also working to support people. So she also has a wealth of experience about how that experience goes in a rural community.
We look forward to Juanita as well. And finally, we're going to be speaking with Jennifer Cameron. And Jennifer is one of the Society's special events officers. I call that the Fun and Games Department. She's going to be joining us in the studio. She's here now, and she's going to be talking about Coffee Break, which is an upcoming fundraiser for the Society. It's a big deal, isn't it?
Coffee Break is a really exciting event. It is actually rolled out across the country, but here in BC, we get very excited about it. And again, it's a wonderful example of an event that can be done in any type of location and any type of group. And I think Jen will share a lot of exciting ideas about how people can do that no matter where they live.
We'll get a little history behind the concept of Coffee Break and how it works and how you as a listener can actually help as well. Sounds like a lot of fun. I look forward to hearing more from all of our guests today. This is BoomerLife on CL650, joined in the studio with our friends from the Alzheimer's Society of BC. CEO Maria Howard is here, and we'll be back with some great stories from a caregiver in Ashcroft. That's next on BoomerLife on CL650.
Celebrating the baby boomer lifestyle. This is BoomerLife on CL650.